everybody to the 2025 STEM Careers Beyond MD and PhD virtual workshop. We have a wonderful panel today of four experts, four persons in completely different careers that are all within the biomedical space, none of which require a medical degree or a PhD. And the purpose of this workshop or this series is really to highlight how many lucrative and important career paths there are that you can discover at this point and perhaps start to explore how you might navigate towards entering those careers. I'll encourage everybody to follow or to engage with our LinkedIn page. This is where you can learn about all the other workshops we have going on. It's also where we post opportunities, research opportunities, summer opportunities, scholarships, etc. And then our YouTube channel is where you will find all of the past workshops, the ones that we're able to record. I will note that we have to get permission from every speaker to post videos on YouTube. So sometimes some sessions might be missing and we do not record the Q&A. And so without further ado, we're going to jump right into our first speaker, Darylyn Milburn.
Good afternoon. My name is Darylyn Milburn, and I am a certified registered nurse anesthetist. And I have been practicing as a CRNA since 2013. So here is my presentation. I am currently working at Johns Hopkins Hospital under the University School of Medicine. I am also the assistant clinical site coordinator of graduate nurse education. So when we have students that rotate through our clinical site, I assist with helping them get set up and then with their access and everything else. And then also just checking in with them to make sure that they are getting the educational experience or clinical experience that they need. So I got my BSN from East Carolina in 2002 and then started working as a CRNA at Inova Fairfax after I graduated from Villanova in 2012. And then worked there for about 14 months and then came back to Johns Hopkins as a CRNA. Prior to going to nurse anesthesia school at Villanova, I worked 8 years in the cardiac ICU at Johns Hopkins Hospital. And since then, I've just been involved in a lot of the cohorts that we have as in at Hopkins, which includes GYN onc, otolaryngology, endoscopy, outpatient, and transgender cases. And I had the honor of being recognized as one of the top 100 nurses in the DMV, which is DC, Maryland, Virginia region. Okay, next slide. So what is a CRNA? Certified registered nurse anesthetist. We're advanced practice nurses who collaborate with surgeons, OB, dentists, and other healthcare providers to deliver safe, high quality, and cost-effective anesthesia care to patients in virtually every healthcare setting. At Hopkins, we have a collaborative system where we discuss the anesthetic plan with the anesthesia and surgeons, with the anesthesiologists and surgeons. So it's not necessarily having someone tell you what to do, but we get to sit down and discuss what is necessary for the case based on the health of the patient. CRNAs practice in all 50 states and in the military, and we deliver more than 50 million anesthetics each year. The first nurse to specialize in anesthesia was Sister Mary Bernard in Pennsylvania, and that was back in 1877. But nurses have been practicing anesthesia for more than 150 years. I also want to note that the national organization is the AANA. You can certainly go to their website and learn more information about CRNAs, what we do, where we are, how we practice. There are certainly a lot of independent CRNA groups delivering anesthesia in areas that otherwise might not have access to anesthesia for their procedures. So I got into nurse anesthesia. It started off as a conversation with friends. It was three of us on the phone lamenting about jobs at that time. I had been working in a lab setting for quite a bit of years, and it was actually not meant for, it was supposed to be just a temporary thing, but I guess I got a little comfortable. So one of my friends mentioned that she saw postings for a nurse anesthetist, and I had never heard of that. I did not know nurses could specialize in anesthesia. So I did my homework. My first degree was biology pre-med. So after researching nurse anesthesia, I decided that I would have to go back. Well, it wasn't just a decision, but it was a necessity. I would have to go back to school for my nursing degree and then went on from there. So the requirements are you do need a BSN degree and a nursing license. CCRN, I did not do that, but it's so competitive now that a lot of the candidates for that are applying for programs have this CCRN certification, and that's a critical care nurse certification. You must have your BLS, ACLS, and PALS, which are your life-saving techniques beyond just CPR. Greater than 2 years of ICU experience. I had 8. Again, I wasn't intending on staying that long in the cardiac ICU, but I really enjoyed what I was doing. And when the time came, it was just time for me to move on. A cumulative GPA of 3.5. Um, some of the programs are moving away from a GRE, so you just have to look into what the programs are, requiring as far as the GRE goes. Um, we do recommend that you shadow CRNAs at least 8 hours, and we at Hopkins do have a program set up where the nurses who work at Hopkins can come and shadow us in the ORs. 3 letters of recommendation, and then a personal statement. Again, it's each program is different on what they want in these essays. Pros and cons. The pros for me, I enjoy what I do. I enjoy meeting patients, the families. I always say that you have 20 seconds or less to have these strangers believe that you are going to take absolute good care of them and that they are the most important person in your hands at that time. Um, I enjoy working with my colleagues in collaborative setting and collaborative care. And just all around, this was definitely the best decision that I could have made for me. The cons could be that there's always politics in these types of things. When I say politics, there are different places where it seems that there's the CRNAs and the anesthesiologists might have a contentious type of relationship, but for the most part, we know that we need to come together because we have to take care of the patients, and the patients are the most important people there. We're there for them. So there are lots of CRNA jobs out there. The need is great at this time. I think we have a lot of older CRNAs who will be retiring. So, and then also because of the pandemic, a lot of hospitals got behind in their surgery schedules. So they want to try to get as much done as they possibly can, and they just aren't able to when they don't have enough staff. So I recommend CRNA if you are interested.
Thank you
Thank you.
so much. Thank you so much for that introduction to the CRNA training and practice. Now we'll move right along to Jamie Costas.
Hi, everyone. My name is Jamie Costas. I am a senior scientist at Merck in West Point, Pennsylvania. First, I just want to thank Jenny L for inviting me to speak today. Just first give a little bit of background on me. I graduated from the University of Delaware with my undergrad, and then Thomas Jefferson for my master's degree. I've been at Merck for 8 years. I've been in the same department for that entire 8 years, although I think our department name has changed at least 4 times, which is something that's pretty common in industry. Just a couple icebreakers about me. I'm pretty obsessed with Candy Crush. I've beaten over 15,000 levels. I've been a soccer referee for 20 plus years now, and I love anything that's Star Wars and or Legos. So those two coming together was just amazing for me. I have a 3-year-old daughter. I love traveling. And then I'm a big Philly sports fan. So love all my Philly sports teams. So just a little bit about my career journey. So I started at the University of Delaware in 2007. I really didn't know what I wanted to do when I started in college. I declared a major because that was the easier thing to do. I liked some of the biology work that I had done in high school. So I said, okay, I'll declare a biology major and just see how it goes. In 2009, I got an internship at Fraunhofer USA. So that was actually an internship that was only a couple miles off campus from University of Delaware. And so they worked on generating virus-like particles for plant-based vaccines. So on the left there is a picture of their large-scale inoculation room. And then what I did was I actually worked on like the more upstream, the smaller scale. So I was actually inject bacteria into plant tissue manually and use that to kind of develop our processes. I was lucky enough that they actually offered to keep me on after my internship ended at the end of the summer. And because it was only a couple miles off campus, I was able to work there, 15 to 20 hours a week while I was going to school until I graduated in 2011. Graduated with a BA in biology from University of Delaware, and then I moved on. Again, even at this point, I really wasn't very sure what I wanted to do with my career. I didn't think I wanted to do a PhD only because I felt like a PhD was a little bit too restrictive. People that I had known that had PhDs were kind of doing the same exact thing, and they really didn't have any flexibility because they were so specialized. So I decided to find a job as a research technician, and around the Philadelphia area, there are a lot of great universities and hospital systems. So I was able to get a job as a research technician at Thomas Jefferson University. And in our lab there, I was responsible for the production and validation of a anti-fibrotic antibody. So I would produce the antibody and characterize it. And then we actually had a model for wound healing in rabbits. So I was able to get some experience with animal care. And so on the top there is an X-ray of an animal knee with our pump inserted under the skin, pumping antibody directly into the knee joint. And so I think at Jefferson is kind of where I developed my love for science. It really got me excited for the kind of things that I was doing, and I could see a career at that point. And so while I was there, I got my master's degree. So in May of 2016, I graduated with my master's degree. And then in 2017, I started working at Merck as a scientist. So West Point is right outside of Philadelphia. So go to the next slide. So what do I do at Merck? So I work in the protein and structural chemistry department. So our group is responsible for elucidating the structure of the protein targets that we're working on. So in order to treat or prevent disease, we first must know what protein contributes to that disease state. and then try to figure out what that protein looks like in its native state. And then we use that protein structure to develop molecules that can interact with that protein target to either inhibit or activate that molecule. So I think everybody is very familiar with SARS-CoV-2. So one of the first things that scientists did when SARS was discovered was that they determined the molecular structure of the spike glycoprotein. And this is the protein that actually binds to the ACE2 receptor in your respiratory tract and actually allows the virus to get into your cells. So my boss actually described it really well, kind of what structural biologists do. He kind of describes us as locksmiths. So we try to figure out the structure of the lock, which is the protein that we're working on, to try to figure out what kind of key to develop and what shape that key should be to either inhibit or activate that protein target. So there's two primary methods that we use for this kind of work. So X-ray crystallography, where we super concentrate the protein that we're working on, and then we shoot X-rays at it. And based on the diffraction of those X-rays off of your protein, you can elucidate the protein structure. And then there's another way using cryo-electron microscopy, where you put your protein sample on these grids, freeze them in liquid ethane, and then use a very high resolution, high magnification microscope to actually view the protein structures. So if you go to the next slide. So kind of this is a very collaborative process. So I only work on one very small portion of the protein and structural chemistry workflow. So our group as a whole starts with the design. We find a protein target. We design tens to hundreds of different protein constructs of that target. So we might only express certain domains of interest, certain mutations to stabilize the protein, different tagging schemes, different signal sequences, things like that. And then what I do, the group within protein structural chemistry that I work in, is the expression group, the cell sciences group. So we do all of the high throughput expression in eukaryotic cell lines. And we do a high throughput first pass purification and analysis. And then based on the results of that analysis, we will scale up our protein expressions anywhere from 1 liter to about 10 liters. And then we'll pass that off to our purification colleagues who will do the larger scale purification and validation of that protein. And then they will pass it off to our structural chemistry colleagues who will do the structural sample prep and the structural determination. So this is a very, very collaborative process. It's very nice to be able to work with so many different people across so many different sites. It's a very interesting, very engaging way to work. So with that, I'd like to thank everyone for listening to me.
Thank you so much. And we'll move right along to our pharmacist, Edouard Naime. And please correct your pronunciation of name.
Thanks so much, Danielle. So yes, my name is Aju Nyame. I am currently a clinical pharmacist in anticoagulation, smoking cessation, and oncology over at Johns Hopkins Bayview Medical Center. So I'll start off by kind of defining what is a pharmacist. So I know typically most people kind of think of a pharmacist as your brick and mortar CVS, Walgreens pharmacist, but there's a lot of pathways in pharmacy. So I'll talk about that a little bit more in the next slides. But generally, the definition of a pharmacist is a licensed healthcare professional that participates in dispensing medications, verifying the appropriateness of medications, providing medication recommendations to providers and the healthcare team, monitoring drug interactions, administering injectable medications such as vaccines, counseling patients on appropriate medication use to ensure that they have optimal outcomes, and educating other healthcare professionals on new updates as it pertains to medication. So really, pharmacists are anything and everything that deals with medications. When we think about pharmacy, I think about it in really two big buckets when I think about the various career pathways. So, clinical, which is more so like our patient-facing job types in pharmacy, and then non-clinical, which tends to be they're in the background, they're doing more non-patient facing things, but things that really are impactful in healthcare still. So, from a clinical perspective, we have our hospital pharmacists, also sometimes known as like staff pharmacists, who tend to be our pharmacists that verify our orders. So when a provider or an authorized provider puts in an order in a hospital, someone has to verify that it's appropriate for the patient, that there are no drug interactions, and that it makes sense. There's like an indication for it, and there's a reasoning. And so that's what our staff pharmacists will do, and our hospital pharmacists will do. They'll verify those orders and make sure that it's appropriate. And then they'll also check the products that are going out to patients to make sure that it's in date, that it's not expired, that it's safe, that it's effective, that it makes sense, and it's the right medication. Then we have our clinical pharmacists. And that's essentially what I do. So, clinical pharmacists, we occasionally, yes, we verify orders and we make sure all of those same things, that it's appropriate and that it makes sense. But it's that next step that clinical pharmacists do as well. So, they'll make sure that the medications are appropriate, but we'll also provide recommendations to our teams. So, we'll let the team know, based off of this indication or this new trial or new study, we think that this medication may be the most effective for the patient. Or we may say, based off of the patient's current kidney function, we would think that this medication should be dosed at this dose, just to make sure that we're not causing any harm or additional toxicities to patients. So that's that clinical pharmacist perspective. And within clinical pharmacy, there's several different pathways. So as I mentioned, I work in anticoagulation, smoking cessation, and oncology. But you can also see clinical pharmacists in critical care, emergency medicine, internal medicine, and family medicine in the outpatient realm as well. So it's a vast opportunity. There's lots of opportunities and places that pharmacists can work in. And then, as I mentioned, like when we think of pharmacists, we kind of often think of like our community pharmacists. So, pharmacists that work in the outpatient setting at places like CVS and Walgreens. And so, those pharmacists, they are out there for patients to answer questions as they pick up their prescriptions that may have been prescribed by an authorized provider. And then also answer questions for anything that patients may have as it pertains to over-the-counter medications. So that's another route that you can look at. Then there's something called ambulatory care pharmacist. So technically, I actually classify as a clinical pharmacist, but also an ambulatory care pharmacist. So ambulatory care pharmacists are essentially outpatient pharmacists. They work in various outpatient clinic settings, uh, such as family medicine. So think of like your hypertension, diabetes, things along those lines. But also areas that are maybe a bit more specialized, like anticoagulation, working with blood thinners, or areas such as gastrointestinal clinics that are outpatient that patients may follow up with. And then finally, there's academia, which I know we wonder, why is this clinical? So academia is an interesting area in pharmacy and generally in medicine. And so with academia for a pharmacist, you not only educate pharmacy students, but you also participate in clinical research, and you also have to practice at a clinical site. So these academia pharmacists, they also work either in a hospital or in the outpatient setting. So a lot of different realms for them, but they have those opportunities to still teach, but still also engage in clinical practice. And then within pharmacy, there's the non-clinical routes. So you could do something such as pharmaceutical industry. So just thinking about pharmaceutical drug companies, pharmacists work heavily in those areas and places such as pharmacovigilance. So really assessing and making sure that the medications are safe and effective and make sense for patients and things along those lines. Then pharmacists work in pharmacy management. So within a hospital, we have our various pharmacy managers. They oversee the day-to-day and the large picture items for the pharmacy as it pertains to the health system. So that's another route and avenue that you can go within pharmacy. Then we have our managed care pharmacy, which is really more so pharmacists that work in insurance settings. So they work with insurance companies, making sure that the medications that are on the approved list of medications for patients, or what they call like a formulary, makes sense. They also assess, like, if a provider puts in an order, for example, like in an outpatient setting, does this medication make sense for the patient's indication? So just making sure that it's the most safe and effective situation for patients. And then we have regulatory affairs. So that's something like working at the Food and Drug Administration. So pharmacists work in that setting to make sure that the medications that are going to be approved are safe and effective for patients. So making sure that it's a very safe avenue, making sure that everything makes sense and all of the studies are relevant and have appropriate data to back up their safety and efficacy. And then you have things like nuclear pharmacists. So they are who work overnight and make sure that those diagnostic medicines or IV medicines are appropriate and safe for patients and are made appropriately and then delivered to the health system or hospital settings for use the next day for patients. So in terms of my career pathway, I took a very non-traditional path to pharmacy. And I'll tell you kind of what your options are in terms of your traditional path versus kind of what I did. So how did I discover pharmacy? I actually discovered it through a family member. So initially, when I was completing my undergrad degree, I thought that I was going to go into law. And my mom actually was talking to me. She said, I really think you'd like pharmacy. And I kept telling her, I was like, I don't think I will. I said, all I see are these pharmacists that work at CVS and Walgreens, and I just don't see that as my career path. My mom kept saying, I really think that you should explore more. I think there's more to pharmacy than what you're seeing day to day. So I actually had a cousin who was a director of pharmacy at a local hospital in the DMV area, who said, you should come shadow me and kind of see what pharmacy looks like from my perspective in a hospital. So I said, that sounds great. I'll go take a look at what this pharmacy thing you're talking about is, but let's find out. So I actually went and shadowed a hospital pharmacist, a hospital technician, pharmacy technician, and then a clinical pharmacist, and immediately fell in love and realized that there's so many other career pathways to pharmacy than what you see just patient facing from a community pharmacy perspective, because that's not for everybody. I think what they do is awesome, and I think they really are impactful in the community. But I knew myself, I said, this is not for me. But when I saw what clinical pharmacists do and the impact that they have on patient care, I knew that that's what I really wanted to do. And so my career path pivoted very quickly, which made me take a very non-traditional path into pharmacy. And so when did I decide to go into pharmacy? It was actually the, I want to say the summer before my senior year of undergrad was when I decided to go, which traditionally you don't have to go that pathway. There are much faster pathways to get there. So in terms of my training route, I actually received a bachelor's of science in chemistry from Salisbury University. So I did 4 years there. And then after that, because I did decide a little bit later in the game to decide to pursue pharmacy, I took a gap year and I did 1 year to complete all the additional prerequisites that I didn't do in undergrad. A lot of the prerequisites that I did for chemistry did overlap, but there were certain biology classes that I had not taken that I needed to complete in order to complete all the prerequisites for pharmacy school. Now, every pharmacy school does have their own set of prerequisites, but generally it's a few general chemistry classes, a few general math classes, biology, and then some stats and communication courses. Um, After I finished my prerequisites, I took the PCAT, which actually is no longer a requirement. So no pharmacy school requires you to take any type of entrance exam in order to get in now. And then after I took PCAT, I applied to pharmacy schools, and then ultimately settled on completing my Doctor of Pharmacy degree at Virginia Commonwealth University in Richmond, Virginia. And then after I got done with that, traditionally you can be done. You have your Doctor of Pharmacy, you can go out and work in the field. But nowadays, a lot of pharmacists will go on to complete some additional postgraduate training, especially if you think that you want to specialize in a certain area. So I went on to complete a postgraduate year one or a PGY1 pharmacy residency at Johns Hopkins Bayview Medical Center. And then after I completed that, I decided to stay on. Now, there are options to go on and complete a second year residency in a specialized area such as critical care, emergency medicine, oncology, things along those lines. But I decided not to go that route for myself because a job opportunity became open at Hopkins, and I had a lot of experience in oncology through my PGY1 pharmacy residency training. Now, the alternative route is you really only need to do 2 years of prerequisites for pharmacy school. So all of the prerequisites that are required for schools are typically about 2 years. And then you can apply. You don't need to take any additional tests. You just kind of apply. In most pharmacy schools, perspective for reviewing your packet is a holistic review. So things like you completed the prerequisites. Were you involved or in various activities like different clubs? Did you work? Have you worked in a pharmacy, which is not a requirement by any means, but sometimes can be helpful for your application. And then they just kind of look at you as a holistic student. They read your essay and your interest in pharmacy and kind of go from there. After you complete your 2 weeks of prerequisites, you can go on to complete your pharmacy school training for your Doctor of Pharmacy. That's between 3 to 4 years. So some programs you can do an accelerated program and complete all of your prerequisites within 3 years. A lot of schools are still doing a 4-year model, but there are some accelerated programs out there. And then after that, optional, you can go on to do postgraduate training by completing either a PGY1 alone or a PGY1 and a PGY2. Depends on your career route. So in terms of some pros and cons of pharmacy, so I'd say some pros of pharmacy would be the versatility in careers. As you saw, pharmacists can do a host of options, a host of opportunities. And the other nice thing is that you can easily pivot. I've had a lot of coworkers start in pharmacy, like in hospital pharmacy, and then pivot to industry and work in pharmaceutical industry. So it's nice that you can kind of pivot your careers. In terms of cons, I'd say biggest one that I think pharmacists will tell you is that it's kind of the limitations in pharmacy practice. There's a lot of advocacy groups for various things like what they call provider status. So pharmacists can do things like prescribe medications that are within their scope of practice or within their job realm. And so I think that's probably the most limitation to pharmacy, but in general, we all love it. So thank you for your time.
Thank you so much. I learned quite a bit. I will move right along to Melody, who will tell us about being a medical laboratory scientist.
All right. Hello, everyone. My name is Melody, and I'm delighted to have the opportunity to represent the medical laboratory scientist career on behalf of the Johns Hopkins Hospital. We can stay on the same slide. If you are like me, you may not have heard about the lab as a profession growing up, and I'll tell you a little bit of my story later on. But for now, if you look us up online, we have historically gone through many titles. So once upon a time, we were medical technologists, but then as technology advanced, we needed to differentiate ourselves, so we became clinical laboratory scientists. And in the past decade, we have been retitled medical laboratory scientists. So 3 long yet essential words that do very well in describing our behind-the-scenes detective role in patient care, where we complete lab tests to assist the clinical care team with diagnosis and treatment information, as well as participating in the monitoring and preventing of disease. Next slide. So in other words, the lab's job is to generate accurate results that provide information in detecting cancer, heart attacks, diabetes, infectious diseases, drugs of abuse, and more. In fact, it is estimated about 60 to 80% of decisions for patients are based on lab testing. And that makes sense, right? So when we go get our yearly checkups, we go to the doctor, we get our blood drawn, it goes to the lab, this magical place, and the results will come back and they'll confirm if we are okay or not. Sometimes they say, hey, more testing is needed. Or a more relevant example, a couple years ago, I had a fever that was lasting for more than a few days and I was feeling awful. So I went to the doctor and they tested me for strep, flu, and COVID. And we were all convinced that it was strep throats because of my excruciatingly painful sore throats. But guess what? I had COVID and flu. So that information changed my treatment plan from antibiotics to antivirals, and I did eventually get better. But we wouldn't have known that without the lab. Next slide, please. So lab testing has several specialties. From at the top, we've got hematology testing, where we look at the red and white blood cells under microscopes. We can use something similar for body fluids. We look at cells and analytes in urine, pleural fluid, and many other types of fluid. We've got clinical chemistry. We look at hormones, electrolytes, tumor markers, cholesterol. Transfusion medicine, they're the ones that help us find the right blood products for our patients, which is more complicated than you think. Because, surprise, there's more blood types to consider besides just ABO. There's close to 50 human blood groups that can affect transfusion decisions. We've got molecular biology. They're expanding their test panels every day. And microbiology, fan favorite. We get to figure out what bacteria, fungi, parasite, or virus is ailing our patients. Next slide. So, how did I get here? Well, it's all thanks to a jar of peanut butter that got my attention. So back when I was in high school, I was directed to basically only two healthcare professions. It was basically be a doctor, be a nurse. So I started exploring my pre-med options at my local college campus. And as I went on tour through their science building, I got to see biology, chemistry, physics departments, the classics. And at one of those stops, we got to see the medical laboratory sciences departments. And I'd never heard of it in my entire life. The program director, she sets out a jar of peanut butter for us and reminded us about the recent, at the time, peanut butter outbreak in late 2008, early 2009. Faculty might remember. So in that time, there was a salmonella contamination that resulted in over 700 people getting very sick with food poisoning, and actually 9 people died. So it was one of the largest food recalls in US's history. It spanned across 46 states. It was huge. So she asked our tour group, how did the doctors know that the patients had food poisoning? Who completed all those tests? Who provided the data for public health officials to find the source of the outbreak? Who was looking through microscopes and petri dishes and identifying the salmonella? Of course, it was the lab. So that got my attention. After looking into it, I was sold. So besides being overall fascinating, the job security was high and the coursework matched up to pre-med requirements. So it was a good major to select that would prepare me for medical school, which was my idea at the time. And it made a lot of sense because if someone wanted to take a gap year between undergrad and graduate or medical school, it was fairly certain that you would find a job in lab and start getting relevant experience. So what's not to love? So briefly, my timeline is I completed my bachelor's over 4 years, and in my senior year, I completed my internship here at the Johns Hopkins Hospital for about 3 months. I graduated, I took my board exams, became certified, and I started working in flow cytometry, which was my first love, cancer diagnostics. Worked there for 5 years. In the meantime, I worked on my master's in education. That is my big passion overall. So now I work more in the education side. So as you can see here on the slide, there are several career pathways that can get you to access the medical laboratory scientist certification exam. That certification is super important and preferred for hiring, especially for patient care. So you can do a bachelor's, that's the top option, or you can also complete an associate's degree as a medical laboratory technician and then complete an additional 2 years afterwards. In the meanwhile, you're working and complete your MLS. You can also discover the lab after you have your bachelor's degree in like a biology or science area and complete a 1-year categorical program to qualify you to specialize in one lab area, such as technologist in microbiology or hematology or blood bank, so on and so forth. You can try to qualify for the exam with your BS degree and lab experience too, but that one has extra hoops and hurdles, so much better to go through some sort of training program. You can also go through the US military with your medical lab training and use your work experience and also pass the quiz. So next slide, yes. When you are a board certified MLS, you can work in hospitals, doctor's offices, medical laboratories, outpatient centers. And as you can see here, the job projections through 2031 are predicted to expand. We've got three big reasons for that. A large portion of our workforce is retiring, hence a lot of open positions. Number two, demand for lab tests are increasing, right? So our US older adult population needs to be monitored for chronic disease, for cancer, type 2 diabetes, so there's increased demand. There's also more molecular, we can stay on the back slide. There's also more advanced molecular and genetic testing that continues to be developed. So now next slide. If you are interested in furthering your education and expanding your job responsibilities, you can, with experience in a lab setting, take a specialist exam and become a technical specialist for a certain department, like the specialist in blood banks, really popular SBDs. You can also complete a master's in medical laboratory sciences, so that will help you advance in regulatory, academic roles, management, research. And then lastly, the Doctorate of Clinical Laboratory Sciences, or DCLS, has emerged as a terminal degree, or the highest level you can achieve in lab science, with the goal of becoming a clinical consultant. So at that level, you can be a lab director or be part of the diagnostic care teams that work on challenging patient cases to advise on the interpretation of the lab results or recommend different laboratory tests. So really similar to our PharmD friend earlier. On the next slide, one of my favorite diagrams is this one because it shows all the many different directions that medical laboratory scientists can take their career. So as you can see, they can advance through research, public health, IT, industry, administration, academia. And as I glance through this, I can safely say that I have colleagues in pretty much all these areas that have used their MLS background to branch out into these adjacent fields. So to summarize, we can talk about the pros and cons. Pros. Lab work is especially rewarding if you have a passion for science, you want to make a positive impact, and if you lean a bit more introverted, like me. Lab work also has a strong job security for the foreseeable future. Lab is not going anywhere. And there's a wide variety of ways to apply your lab skills in and outside healthcare, so lots of ways to grow and advance. As far as the cons go, I really need to emphasize that the main focus of our job is behind the scenes. So if you really are wanting to be at the patient bedside, then another allied healthcare profession is going to be a better fit. And then recognition, the lab suffers from being largely unknown. So being ready to continuously explain yourself to your family and friends, and even on the phone with your fellow healthcare team members, advocating for a profession is an all hands on deck situation. To close off, I can't imagine not working in the lab. I fell in love with it in college, and it appeals to my lifelong learner personality and continuously surprised me at how much there is to do in this field. I recommend these two websites, Hopkins Careers and then our agency, ASCLS, American Society of Clinical Lab Science, for more resources, or feel free to email me. I love talking about this. Thank you for your time.